If we now have a look at the management of diverticulitis, this tends to be based around the Hinchey classification. The Hinchey classification is a scale of increasing severity, going from mild or simple diverticulitis all the way up to perforation with fecal peritonitis. And the management of patients with diverticulitis varies depending on what Hinchey classification they have. For mild diverticulitis, where there's inflammation in the colon but nothing else, these patients can usually be managed with broad-spectrum antibiotics, analgesia, and if they're significantly dehydrated, then we can admit them for IV fluids. It's actually not uncommon for these patients to be treated in the community without needing to actually be admitted as inpatients. There is some evidence to suggest that these patients may not actually need antibiotics at all, but at present, this is something that hasn't been universally accepted yet. Hinchey I refers to when a patient has developed a pericolic abscess, which is basically an abscess adjacent to the colonic wall. Most of the time, we can manage these patients in the same way as we do with mild diverticulitis. So with analgesia, IV fluids, and broad-spectrum antibiotics, again, most likely through the intravenous route. In Hinchey II, the patient has developed a collection or an abscess that's sitting in their pelvis. In terms of the management of these patients, you can see that there's definitely a pattern, as our initial management is pretty much identical to how we managed the earlier classifications. However, in some cases, particularly if our patient is not improving, we may have to ask our radiology colleagues to perform a percutaneous drainage of the pelvic collection. And by doing this, and getting rid of the pus, this usually allows the patient to settle and recover completely. In Hinchey III, rather than the patient having a contained collection of pus, the patient actually has free pus that's floating around the abdomen. In terms of management, now obviously we're going to give them IV antibiotics, as well as IV fluids and analgesia. If the patient remains relatively well, despite the free abdominal pus, and responds to the above measures, then this may actually be all they need in the acute management of their condition. However, if they're unwell and demonstrating signs of sepsis, or if they fail to respond to antibiotics and IV fluids, then we'll need to take them to the operating theatre for surgical intervention. The aim is going to be to wash out the abdominal cavity and get rid of all that horrible free pus, and achieve control of the surgical source of sepsis, potentially by resection of the diseased segment of colon, which we're going to discuss a bit later on. The last and most severe of the Hinchey classifications is Hinchey IV, which describes when the patient has feces or feculent fluid that's floating around the abdomen, which is really as bad as it sounds. As you can imagine, these patients are really sick and very, very septic. And if they're going to have any chance of surviving at all, they're going to need to undergo an emergency laparotomy, as well as having urgent IV antibiotics, IV fluids, analgesia, and support from the intensive care team. So to summarise the Hinchey classification, if the patient has an abscess, then it's a Hinchey I or a Hinchey II, and we treat these patients with IV antibiotics, plus or minus percutaneous drainage. If our patient has free pus or free feces, then it's going to be a Hinchey III or IV respectively, and we treat these patients with IV antibiotics and IV fluids. And in the case of Hinchey III, if they're septic and they fail to settle on non-operative management, then they're going to have surgery and a washout, either open or laparoscopically. And in the case of Hinchey IV, they're going to need an emergency laparotomy.